Dr. Ishani Chaudhary from the Center of Ilizarov Techniques, India, and today I'm going to be sharing with you one of the most common problems that someone walks into our deformity correction specialized center for. That's basically when either a worried parent brings their child or a worried person comes to the OPD with crooked or deformed limbs. In simple terms, deformity is a crooked limb. What is the normal skeletal alignment? Okay, so this is really important to understand, especially to all the worried parents out there. I want you to know that as your child is going from the time that he or she is born to the time he or she is standing, becomes a toddler, becomes a pre-adolescent, an adolescent, and eventually an adult, there are certain changes that are going to happen in the skeleton or the bony structure of a normal human that will follow a certain predictable pattern according to the age. Not just an increase in the height, but at the time of birth till the time that a child is usually standing and walking, when you see a child from the front, it usually is seen as bow legs or genu varum. From the time of around 20 months to up to 4 years, the alignment changes from bow legs to genu valgum, where the knees are close together, so it's known as knock knees, and the legs are farther apart. This is usually at the peak age at around 3 years of age. Now, from 3 years of age to around 7 years of age, the degree of the genu valgum actually changes or decreases slightly, and by the age of 7, the normal adult alignment, which is usually a slight valgus, is what is attained and eventually will persist. Now, when should a parent be worried or when should you be worried? It's when if there is genu varum or bow legs beyond the age of 3 and if there is excessive genu valgum beyond the age of 7 or 8, that's when it's a great idea to come for a consult. Now, let's understand deformities slightly more. First of all, there are many angles from which a human body can be seen. So, if a human body is examined from the front, it's the coronal plane. In the coronal plane, there are two deformities, that is genu varum, that is bow legs, and genu valgum, that is knock knees. Now, when the human body is seen from the side plane or the sagittal plane, there is genu recurvatum or there is genu procurvatum. There are also rotational deformities. So, there is either in-toeing or out-toeing, as well as difference in the leg length or limb length discrepancy. Why do deformities occur? Now, deformities can occur from birth or congenital deformities. There might be certain problems that happen during the development. There could be certain metabolic conditions. There could be deficiencies. There could be certain infections that happen in children, or a tumor that grows, or any sort of a trauma that eventually leads to change in the skeletal shape. It's important to show these deformities because they are not going to get corrected on their own. In fact, over time, there is a tendency for deformities to get worse without any surgical treatment. Now, how do you take care of your deformity? So, visit a deformity correction specialist and get yourself completely evaluated. So, at our center, we evaluate the patient completely in standing position, while walking, during the bedside examination, taking full length radiographs, measuring all the important angles, and then determining where is the deformity, at what level, and of what severity and how much degree, and then do appropriate in detail planning to take care of it. I hope that this video helps you understand the basic concepts surrounding this difficult topic of deformities in simple and scientific terms, and most importantly, that if you or someone you know has a deformity, it can be treated. This is Dr. Ishani Chaudhary signing out from the Center of Ilizarov Techniques, and we will be happy to take care of your deformities.